a lot of what goes into making our local businesses run, our partnerships, and that includes in medicine as well. Local partnerships coming together in orthopedics and sports medicine in West Bloomfield, including at Lederman, Kwartowitz, Orthopedics and Sports Medicine. Joining us now is one of the newest members of their team. Dr. Michael Fleischman is with us on the Splash Live to talk more about his involvement at Lederman Kwartowitz going forward. Dr. Fleischman, thank you for being with us today.
Good morning. Thanks for having me.
Yeah, glad to have you on to talk about this because it's such an interesting career field to be in, and now to also have this partnership with a group that's been kind of an institution in our local chamber and in our local community, providing that sports medicine and orthopedic medicine coverage in our community. Let's talk about a little bit about you and what inspired you to pursue the career path that you're on.
Yeah, so I've told this story before, but my path all began when I was about 15, and I had an injury of my own on the baseball field, and orthopedic surgeon fixed me up. And afterwards, I asked the orthopedic surgeon, can I come and check out what's going on at your office and in your operating room? And he said, sure, come on into the operating room, and we're going to be doing a knee replacement. And the first thing he did was pulled out a power tool and began fixing someone's knee. And I thought, this is the greatest thing ever. I get to use power tools and help people. So that's kind of how it all started for me.
Yeah, and you mentioned the power tools being something that was used that really interested you, and how that can be utilized not only to fix things around our house or our vehicles or other devices, but also to help us as well. But technology has advanced so far beyond that, and you've kind of been on the cutting edge of one form of this technology, which is robotic technology. Tell us how that has helped to transform particularly joint replacement surgeries.
Yeah, that's right. So the robotic platform has become a regular thing in orthopedics. However, it just began around 2012 in the United States. And I began using it about 10, 11 years ago. And I do about 98% of my joint replacements with robotics at this point. And the advantage to using robotics is really all about precision, because when we put the joint replacements in with more precision, we expect them to last longer, and we expect our recovery times to be faster. So when you combine joint replacement with the sports medicine side of things, everybody just wants to get better faster and get back to what they want to do. And the robot has really allowed our patients to expedite that process of recovery.
And I would imagine, too, Dr. Fleischman, that gives your patients and you and your team as well, the doctors, more options in how they approach recovery or how they approach surgery, or even perhaps not needing such invasive options on the table at all in order to reach the recovery goal and the needs of the patient. So now, what sort of flexibility does advancements in technology provide our patients when they do have an injury and they do need this medical care?
Yeah, I mean, the medical care in orthopedics expands anywhere from injection therapy to physical therapy to all the way to the end of the spectrum is joint replacement. But in between that, we do arthroscopy, which is very minimally invasive surgery where we actually look with a high definition camera into the joints. We can repair tendons and ligaments a lot easier than we used to with what's called the orthobiologics, where we actually repair these tendons and have something laid over them to help the healing process. We use something called PRP that we can do here in the office as well, that we can inject not only into joints, but also into healing tendons like Achilles tendons. And when people get really sore elbows, we can use that technology and that process to help with what we call tennis elbow as well. And so we really do see all the way from the kids to grandma and grandpa, we have this technology that can benefit pretty much any age.
We're joined on the program by Dr. Michael Fleischman from Lederman, Kwartowitz, Orthopedics and Sports Medicine in West Bloomfield on today's edition of the Splash Live. And Dr. Fleischman, with all these advances in technology, they give you more options, they give patients more options, but technology and information can also kind of flood the waters a little bit and give us so much information that people maybe don't understand what they're getting into before they get into it. So how much of a factor does patient education play in your decisions and their decisions ultimately in what their treatment options are and how you move forward with that timeline?
I think that's probably one of the utmost important things that we do as physicians is actually communicate appropriately to the patients so we can educate them so they can make their own decisions for their health care. So when I'm meeting with a patient and I have a consultation, I will lay out their different options that I feel will be beneficial to treat whatever pathology or problem that they have. And then that allows them to have the knowledge and ask the appropriate questions so they can make a decision for themselves. One thing that I learned early on in my career was not to just make the decision for the patient, because part of the getting better outcomes for the patients and getting them better is them feeling like they are involved in the whole process. So that's become a really integral part of my practice.
And how much does professional development play a role in that also in all of this? Because not only does that influence your practice and your understanding of these technologies, I'd imagine also that plays a factor in communicating all this new information to your patients.
Yeah, and there's so much out there, right? I mean, people can get online and read about anything and everything. And that's really what I'm there for is to be the expert in all the different things you read about and coming to talk to me. I never have a problem with a patient saying, "Hey, I read about this," or, "My friend had this. What do you think? Would this work for me?" And I think utilizing your orthopedic surgeon for their expertise is really important. And on the side of the orthopedic surgeon, it's really important that we take the time to answer those questions and communicate appropriately so the patients do feel like they have all the information they need when they're making their decisions.
We're joined by Dr. Michael Fleischman. He is an orthopedic surgeon, hip and knee specialist, and I also see him around with the team at Lederman, Kwartowitz, Orthopedics and Sports Medicine. He joins us on the Splash Live, talking about some of the cutting-edge technologies that are now involved, even here right in West Bloomfield and the greater West Bloomfield area, in treating patients of all different ages and all different body types as they go through a number of different injuries or recovery efforts as well. And there's so much that goes into this. It's a tough job. It's an intricate job. And so having that work-life balance, I'd imagine, is so important for anyone in medicine, and especially for you. So how do you keep that balance that ultimately allows you to stay fresh and provide these incredible treatments to people in our community?
I have a great advantage because every time I leave work and I go home, I've got three young kids. They're 6, 4, and 2. So I don't have to worry about going home and getting refreshed. It's immediately fun as soon as I walk in the door. And as I'm walking out the door and three of them are holding onto my legs, I have no problem refreshing. I'm also quite active myself. I enjoy exercise and playing sports, et cetera. And so that's kind of how I get my release when I leave the office or leave the operating room. And of course, this time of the year, we all look forward to getting outside and enjoying the nice weather now. So just like everybody else, I just enjoy my family time and recreation.
And Dr. Fleischman, as you mentioned that we like to get back out and about this time of the year, be active, be outside, play, and have some fun. As someone that's a medical professional that sees a lot of these common and even some more uncommon injuries in your practice, do you have any advice for people as they are getting back out and about and enjoying their spring and summer and in a more active way to prevent some of these injuries?
Yeah, and that starts throughout the year, even in the wintertime when we maybe don't get outside as much. Staying active 12 months out of the year is very important. And that doesn't mean that you have to go hike through the snow or anything like that, but figuring out a way where you can be active even in your home or getting into an indoor facility where maybe you can do indoor swimming, something like that throughout the year is really beneficial. But now, as we move closer to the time where we're maybe going to push our bodies a little more, it is very important to do what's called dynamic warm up prior to you performing whatever sport or activity you're going to do. So, for example, if you're going to play tennis, uh, regular stretching that we think about, where you stretch your hamstrings, stretch your calves, do all those things, that is all very important. But what we know is before you're doing the exercises and the stretching, you need to get your body warmed up. One of the best ways to do that, and what we can almost all do, is just walk. And if you can walk for about 20 minutes prior to doing the activity, it warms up your whole body. Uh, in fact, most NFL quarterbacks now are walking around the field as their warm up for 20 minutes prior to even beginning their stretching exercises or any of their calisthenics or any of their throwing drills. So that's really what I recommend, is walking and then progressing that to some sort of heavier dynamic warm up.
It's great advice, Dr. Fleischman. And just in case anything does happen, accidents happen, injuries happen, it's good to know we have great resources right here in West Bloomfield in case we need some treatment. Thank you so much for your time today.
Thank you. I appreciate it.